Okay, so first I'm going to verify that I have a doctor's order to perform the procedure, and then I'll go in the room. Hi, my name is Kaylee. I'm a student nurse at GCC. I'm going to be changing your IV dressing, if that's okay with you today. First, can I verify your name and your date of birth? And do you have any allergies? Any tape allergies? Nope? Okay, perfect. All right, so first I'm going to wash my hands. I'll put clean gloves on. Then I'm going to don the mask on the patient. And then I'm going to don the mask on myself. Okay. So then I'm going to assess the site before I remove the dressing. I'm going to note any redness, swelling, tenderness, pain. Nope, you're all good. Looks good. So I'm going to take the dressing off now. And I'm going to start from the bottom, work my way up. I'm going to try not to move the lumen around. Okay, so I'm going to throw away this old dressing and old BioPatch. I'm going to reassess the site, again noting for the same things, swelling, pain, tenderness, redness. Looks good. Okay. So then I'm going to take these gloves off and throw them away. First, I like to get my syringes ready, so I'm going to make sure that all of the air is out of them. So my syringes are ready. I'm going to pull up the corner and take this sheet out that is going to hang over the patient. Okay, good. Open this up. I'm going to take my sterile gloves out, and I can prepare those in a little bit. I'm going to take my BioPatch out of the packaging without touching it, and then I will do that with my positive pressure valve as well, and without touching it. It's in my sterile field now. So now I can put my sterile gloves on. So I have my sterile gloves on now. And I'm going to take the ChloraPrep, and I'm going to break it, and I'm going to rub it in the palm of my hand. And then I'm going to clean the skin all around the site, including underneath the lemon. Okay, you can throw this away. So now I'm going to put my new BioPatch on. And I would put any skin prep I had on at this time as well. And I'm going to get my dressing. Okay, so my new dressing's on. I'm going to take my Q-tip that has alcohol on it, and I'm going to clean the rest of the lemons pretty well. Okay. So now I'm going to make sure that all of my lemons are clamped, and I'm going to get ready to flush them. So I would do that by taking the old positive pressure valve off, throwing that away. I'm going to clean it with alcohol. I'm going to scrub for about 10 seconds. Okay. I'll let that air dry. And then I'm going to flush it with my saline. So I'm going to put about 2 cc's in. And then I'll aspirate, looking for blood return, and I'll note the sluggishness or briskness of the return. And then I push the rest of the saline in with a push-pause method. I would have put my positive pressure valve on before I flushed the IV. Then I would have flushed it. So after it's flushed, I'll put my Kairos cap on for facility protocol. And then before I take my flush off, I'm going to make sure that it's clamped. And then I would perform the same procedure to the other 2 lemons as well. And now I can take my gloves off. I can take my mask off and the patient's mask. And then I need to put my documentation on the site. So I'm going to note my date, time, and initials that I did the dressing change. And I'll place that on the dressing. Okay. Now I'm going to make sure the patient's comfortable. Are you comfortable? It's good. Make sure the patient's safe, so they're in a safe position. I would lower the bed to the floor And then I'm going to document the procedure that I did, note my assessment of the skin around the site, the patient's tolerance to the procedure, the amount of saline I flushed in the line, and the briskness or sluggishness of the blood return that I got from